There were several reasons why this was the case, but the context was that we were facing rising numbers associated with the COVID pandemic. And we began to appreciate that not every one of these patients needed to be admitted in the hospital, or necessarily to stay very long in hospital. And therefore, we had to change the way we were looking after COVID patients in order to free up precious bed capacity for other patients who had an acute need to be admitted in the hospital for hospital-based care. Initially, there were community isolation facilities, then community treatment facilities, and now even transitional care facilities that were formed to provide this valve, additional buffer capacity to allow us then to continue to look after patients who did not need hospital-based care. But as we raised these interim community-based facilities, it wasn't just an issue of creating a structure, a shell, a building, putting equipment in. We needed to find the right people to set the facility up, to set up the processes, and then to start thinking about the quality care that we needed. At that time, as an interim, they were being nested across several hospitals. They became a ready pool of staff that we could tap on to help us then to staff and operate these community facilities. But more importantly, it wasn't just needing people on the ground to provide care. We need leaders. We needed a managerial team. We need someone who will be able to provide the thought leadership, the guidance, the governance, and to make sure that the community facility started on paper but became delivered and was able to succeed in operations. Woodlands provided that team. They had a strong leadership team that was already in the midst of designing the future hospital. We were also very confident in the Woodlands team because they had already been helping us, supporting us, running several step-down facilities actually for COVID patients. And therefore, it gave us a lot of confidence that if we pivot them to step up now to even running a facility that was a hospital minus, more than a nursing home, they will be able to deliver this with a great degree of confidence. And indeed, the Woodlands team supported us here. And they did it not just once, twice, no, at least 3 times they were doing this. And each time it was a successful mission.